something you said earlier about redefining what hospitals actually mean in the 21st century. And it sort of brings me to the work that Kara and Dr. Thornton are actually involved in. It's a proposal currently measuring hospital contributions to community health and equity. So I wanted to give them the floor to talk a little bit about that proposal and what you see actually coming from that. And we can go a little bit deeper in as much as Andre Robinson is a community developer, and I'm certain that he's got a lot more that he'd like to add to that conversation. So Dr. Thornton, did you want to lead off on that survey, that current survey?
Sure. Thank you so much for the opportunity, Kareem. I think it is essential to get feedback from organizations like yours, from the faith-based community on this concept. And frankly, I think there's no better time to introduce it than in the context of the pandemic, as I was saying earlier. And really the idea here is so there are a variety of different ways that hospitals get ranked in terms of their quality or their performance. And the Bloomberg American Health Initiative, led by Dr. Josh Sharfstein, and the Center for Health Equity, led by Dr. Lisa Cooper, with me as the lead from the center for this particular project, are partnering with IBM Watson Health in reimagining how they can hold hospitals accountable and incentivize hospitals to invest in community health and equity on par with the investments they make in healthcare quality and patient experience. And so the idea behind this proposal is to really use evidence to inform the development of an additional measure to be counted on par with the other measures in this ranking system that IBM Watson Health stewards, called the 100 Top Hospitals ranking. And really, we are coming from the standpoint of what Dr. Galeazzo's mentioned earlier, which is this notion that health is more than access to healthcare or delivery of healthcare. Our premise is that healthcare needs to be delivered equitably, effectively, and appropriately, and it needs to be accessible in a just way. The idea here is to propose measures and performance measures that reflect a hospital's commitment to investing in the community where it's located. So there are 4 components that we're proposing as part of this measure, which I just want to rattle off quickly. And the 4 components of the measure are holding hospitals accountable for population health outcomes. And here we would be assessing the progress in decennial trends, so trends over a 10-year period, in life expectancy and in preventable hospitalizations in the county where the hospital is located. We would be providing them opportunities in component number 2 to report on their role as a healthcare provider in promoting community health. And in this space, we've identified best practices like offering smoking cessation services and treatments to every patient who enters the hospital, for whatever diagnosis they're presenting with. Things like being a baby-friendly hospital, doing appropriate screening for intimate partner violence, and a variety of other things. And the 3rd component, this is really about the hospital as a community partner. And here, we're talking about the ways that hospitals partner with other organizations in their community outside of what they do within the walls of the hospital. So to some of Kara's earlier comments, this would be a place where a hospital could partner and meaningfully invest in improving access to healthy foods in the neighborhood. To Andre's expertise, this is a place where hospitals could contribute meaningful investments to affordable housing, quality affordable housing in their communities, to community development, to supportive services and supportive housing in their communities. And then the 4th component of the measure that we're proposing is around this idea of hospitals as anchor institutions. And frankly, I think this is where reversing some of those structural inequities that hospitals as institutions have contributed to over time is potentially on the table. So this is where hospitals can demonstrate their commitment to equity and to community health by having demonstrated plans for improving the diversity in representation in the board, the board of trustees of the hospital, in the C-suite positions and top-level management positions within the hospital, in demonstrating that they're committed to procurement practices that would prioritize investing in local businesses and minority-owned businesses in their community, in making commitments to provide compensation that is aligned with living wage metrics in their geography, providing access to affordable quality childcare for their employees. If COVID has done nothing else, it's shown a light on all of the essential workers, the healthcare workforce, who themselves are food insecure, housing insecure, economically and financially struggling. And then in this anchor institution domain, we've also highlighted things like paid sick leave, again, something that is essential here in the context of the pandemic, but there's a significant evidence base to support its value to community health otherwise. And then things like do no harm collection policies. So in all four of these domains, we have highlighted examples that some hospitals and health systems are already implementing that are based on the research evidence around the social factors and the intervention approaches that positively contribute to community health, and frankly, in many instances also are designed to combat inequities and health disparities.